Hello YouTubers, I'm Dr. Tahir from Youthful Medicine. I was thinking to share with you guys some of the examples of the patients that I'm seeing that have weight loss treatment started with me. This is um, a a patient that is in her mid 30s, and she is struggling with weight problem, and I will share with you a little bit about the uh, problem that she's facing, and I also want to highlight what other medical problems patients who have obesity can come with you, and how a doctor who is knowledgeable in addressing obesity and other relative complications can handle such a patient. So this patient has what we call weight in the range of obesity, and she is about 45 pounds overweight, uh, and I started her on about 2 months ago on the weight loss treatment. Before we started, we got extensive baseline labs, which included her lipid profile, her blood glucose levels, her hemoglobin A1C, iron levels, thyroid function testing, homocysteine levels, C-reactive protein levels. All of these things are really important because you want to treat the patient not only just by their weight, but also understand what metabolic problems are happening. And I found out that this patient had basically multiple issues going on. To list a few, well, she was in obese range. She had prediabetes, and she also had iron deficiency anemia. Iron deficiency anemia you can check by low levels of iron, and also low levels of ferritin, which is iron saturation level. She also had acid reflux. Now, when you have overweight, it causes increased amount of pressure intra-abdominally and causes acid reflux, and that can lead to symptoms of burning in the esophagus and other digestive issues. And prediabetes, which is indicated in this patient by elevated levels of insulin. So when your doctors are treating you and they're looking for hemoglobin A1C, another way for us to look at anybody's risk of diabetes is to look for insulin levels. So I started her on Zepbound treatment with 2.5 milligram for the first 4 weeks, and she had lost about 4 to 5 pounds. And then the second time I increased her dose to 5 milligram Zepbound, and then she had about 8-pound weight loss. Now she is actually coming back with a total another 6-pound weight loss on the same medication dose. So 5 milligram I extended for another month. Some patients who are really good responders, I don't rush them to higher dose right away because I want to make sure that they are able to tolerate the side effects of the medication, and I'm getting the best outcomes from each study. If I accelerate the dose too fast, it can increase the risk of complications like pancreatitis, nausea, vomiting, increased amount of fatigue. But I also want to make sure that I'm getting them in the right set of lifestyle habits, so that they are able to understand that, okay, if I'm eating less, I'm cutting back on unhealthy foods, I'm losing weight. And also I encourage them to continue doing workouts. 20-30 minutes of strength training is really important for when you're losing weight, because as you break down your muscle, as you're losing weight, you need to increase your protein intake and build muscle. So all of this thing I am going to suggest that you also keep in mind. So again, weight loss journey is a journey of lifelong improvement of your health. Number 2, make sure you eat good protein. You work with a doctor who can also look into comorbid conditions, which are usually metabolic syndrome like high cholesterol, diabetes or prediabetes, high homocysteine level, and high inflammation levels, and acid reflux. So these are common problems, including iron deficiency anemia, that I see in my patient population. So working with weight loss doctors is also important, that they're knowledgeable about helping you achieve a better, fulfilling life. All right, until next time, take care.